I'm a psychiatrist, and a few weeks back, I had a patient come in convinced that they were going through a rough patch. I mean, they were irritable with everyone, they could not sleep, everything hurt on your body, but sad? No, no, no. They weren't sitting around crying or feeling hopeless, so in your mind, nope, not depression. So we dug deeper. You see, turns out they'd been dealing with the symptoms for 8 months, 8 full months before they agreed to come see me that day. You see, this is a huge problem. Most people think depression looks like someone curled up in bed, crying and can't get up. And while that certainly happens, depression also shows up in ways that do not fit that picture at all. Which means millions of people all over the world may be suffering and have no idea what they're actually dealing with. So today, I'm breaking down 5 depression signs that don't just look like sadness. Now, if you're new here, I'm Dr. J. I'm a medical doctor specializing in psychiatry, and my sole purpose is to make mental health make sense for you. So, our very first sign is irritability and anger, and this gets missed constantly. Now, when most people picture depression, they think sadness, low mood, maybe some crying. But here's what I see all the time in my practice. People who are just plain angry. I'm talking snapping into kids, road rage, getting into arguments over nothing. And usually like, I'm not depressed, I'm just pissed off all the time. But that irritability, that is depression for a lot of people, especially men and children in their teenage years. Now think about this. For simplicity, let's say someone's brain chemistry is off. Serotonin and norepinephrine, which are the neurotransmitters that help regulate mood, are not working right. Now for some people, that shows up as sadness. For others, it shows up as a short fuse. Everything feels harder. Everything annoys them. They have zero patience. Okay, I want to help you connect this to a concrete example. So picture a dad who used to love playing with his kids. Now, when they ask him to play, he feels this surge of frustration. Not because he doesn't love them, but because his brain is so depleted that even a simple request just feels so overwhelming. So he snaps, and then he feels guilty, and then he gets more irritable because he's beating himself up. I hope you can start to see how that feeds into itself. You see, the DSM-5, which is the diagnostic manual that psychiatrists like me use, actually lists irritable mood as a core symptom of depression in children and adolescents. And research shows it's way more common in men, especially, than people realize. Okay. Our second sign, physical pain with no clear cause. And this one surprises a lot of people because they think, how is pain a mental health symptom? Well, here's the thing. Your brain processes both emotional pain and physical pain using some of the same pathways. And when those neurotransmitter systems aren't working right, pain signals can get amplified. So someone with depression might have chronic headaches or back pain or stomach issues, or this vague sense that everything just hurts. Then they might go to the doctor and get tests, but everything comes back normal. And they're left thinking, am I making this up? Well, no, they are not making it up. The pain is real. You know, their nervous system is genuinely sending pain signals, but the root cause isn't an injury or disease. It's depression affecting how the brain processes sensation. Picture someone named Bob who's had lower back pain for 6 months. They've tried physical therapy, pain medication, imaging scans, but nothing shows a clear problem. However, when I ask Bob about their mood, their sleep, their energy, it turns out that they're exhausted all the time. They've lost interest in their hobbies. Bob feels like they're just going through the motions. You see, actually, research shows that 2/3 of people with depression report physical pain as a major symptom. And for some people, the pain is even more prominent than the mood symptoms. Fun fact. Our third sign is loss of interest in everything. And this is called anhedonia. Now, don't let the fancy term throw you off. Anhedonia means loss of interest or pleasure in the things that you used to enjoy. And this is different from just being bored or tired. This is when activities that used to light you up, like your hobbies or spending time with friends, or even sex for some people, now just feel flat and empty. For example, let's say Bob used to love cooking. Bob would try new recipes, he would experiment with different flavors, he would get excited about new cuisines, but now he just cannot be bothered. Even thinking about cooking feels like a chore. Not because he's too busy, but because the reward circuit in his brain, which is driven by dopamine, isn't firing the same way. You see, anhedonia is actually one of the 2 core symptoms required for a depression diagnosis. The other is depressed mood. But you only need one of these 2 to make the diagnosis, which means you can have clinical depression without feeling particularly sad, especially if you've lost interest in basically everything else for at least 2 weeks. Now, this symptom also shows up in how people talk about the future. Someone with anhedonia might say, I don't know what I'm looking forward to. Nothing sounds appealing at all. You see, that flatness, that inability to feel excited or motivated, that's a huge red flag. Okay, our 4th sign are sleep problems. And these are on both extremes because here's something a lot of people don't realize, and that's the fact that depression can mess with sleep in opposite directions. So some people can't sleep. That's insomnia. They lie in bed for hours, their mind's racing and they just can't shut it off. Or they fall asleep fine, but wake up at 3 a.m. and just can't go back to sleep. But on the other hand, other people just sleep too much. They're in bed for 10, 12, 14 hours a day, and when they wake up, they still feel exhausted. That's called hypersomnia, and it's just as much a depression symptom as insomnia. Now, both of these create a feedback loop that makes depression worse. Because think about this. If you're not sleeping, your brain doesn't get the restoration it needs. Therefore, mood regulation suffers. Now, on the other hand, if you're sleeping too much, you're probably also withdrawing from life. You're skipping activities and you're isolating. And unfortunately, that lack of engagement also makes depression worse. I want you to picture someone who's sleeping 12 hours a night, but still hitting the almighty snooze button 7 times in a row. They finally drag themselves out of bed and are able to go to work, but they come home and immediately crash on the couch. On weekends, in bed. They're not refreshed, they're not rested, they're just checked out. Now, in my experience as a psychiatrist, when I see patients in my practice, one simple question I ask to try to elucidate this symptom is, even when you sleep a lot, do you wake up feeling rested? If the answer is no, and this has been going on for multiple weeks, that may point towards depression and not just needing more sleep like we would initially think. Okay, our 5th sign are cognitive symptoms like brain fog, difficulty concentrating, and what I call decision paralysis. You see, depression doesn't just affect your mood, it affects your brain's ability to process information, to hold things in your working memory, and to make decisions, even really tiny ones. So, someone might sit at their desk staring at an email for 20 minutes, unable to formulate a response. Not because the email is complicated, but because their brain just would not work. Or they stand in front of their closet, unable to decide what to wear, and they know it doesn't matter, but the decision just feels absolutely impossible. You see, this happens because depression affects the prefrontal cortex, which is a part of your brain responsible for really important functions like executive function, planning, decision making, and focus. So when that's not working right, even the most basic tasks feel overwhelming. Fortunately, these cognitive symptoms usually improve when the depression is treated. Okay, if you like this video, then I think you would want to watch this video right here that breaks down 3 extremely key ways to differentiate high stress from panic attack, and I really think the second one will surprise you. Be sure to click that subscribe button below so you do not miss out on future videos. I read and respond to every single comment, so join the conversation by dropping one thought that came to mind as you're watching this video, and I may just make a video responding to your thoughts in the comments. In the meantime, I'm Dr. J, and this has been Mental Wealth MD. I will see you on the next video.